In March, when the World Health Organization declared the SARS-CoV-2 infection, subsequently dubbed COVID-19, a pandemic, I wrote a piece highlighting the urgent need to develop a proper diagnostic test. At the time, we didn't understand the complexity of detecting a little-known virus that was nevertheless very similar to other, commonly found coronaviruses. Now, many months later, things look different. Many people have undergone testing and we understand what detecting amplified viral elements implies, as opposed to detecting the antibodies we generate in response to the virus, and we are happier with a pinprick blood test as opposed to having a cotton bud stuck up our nose that feels like it's taking a swab of our brain. We already have PCR, serological, with variations such as rapid tests RDT, enzyme tests ELISA, neutralization tests PRNT, and chemiluminescence immunoassays CLIA, and even breath tests, trained dogs or lasers, and we are beginning to understand that, no matter what a certain ignoramus claims, the tests are the key to managing a pandemic that will be with us for a long time, and which at best will evolve into endemic. We soon understood that a PCR could detect even small amounts of the virus genetic material, meaning it could remain positive long after the infection had passed, as well as being able to be confused with similar viruses. Rapid antigen-based tests can detect the presence of viral proteins and return positive results when a person is more infectious, while antibody-based tests can detect the patient's immune response and are therefore ineffective at detecting the virus during the early stages of infection. In short, different tests for different uses, and all of them submitted to the same usual law of technology. They need scale to be produced more cheaply, simply, efficiently and accurately. The first key to understanding the COVID-19 pandemic is learning to live with it. Many of the measures we have been forced to adopt, such as teleworking, wearing a mask and practicing good hygiene, will remain critical for many years to come. But one of the fundamental ways we can recover a part of our quality of life will have to do, as I commented last March, with developing simpler, faster, more accurate and cheaper diagnostic tests. The first tests we started using to detect infection were not only expensive, but also not very reliable and easily contaminated. The results of mass testing in countries such as Singapore or South Korea led other countries to try to follow the same strategy and test larger numbers of people, as well as to understand that the tests, in fact, only diagnose the situation of a person at a given time, and therefore it was necessary to design strategies that would allow frequent testing. Receiving the results of a test after 2 or 3 days is of little use because we may have become infected during the time it has taken us to receive those results.